Thank you for being here this morning. I want to update you today on numbers and results that we're getting. We have confirmed an additional positive case in Tulsa County, a male in his 40s, and that investigation, we just received the results, so that investigation is ongoing. This brings a total of 6 confirmed cases in Tulsa County out of 67 statewide. There have now been 2 deaths in Oklahoma, one that was reported earlier this week in Tulsa County and one last night from Pawnee County. We know that many people are returning from spring break. We know that many people during spring break have isolated at home. Those of you who are returning from spring break, at a minimum, we ask you to social distance for the next 14 days. If you travel to a spot or a state that's endemic, that has widespread community spread of this virus, we ask that you quarantine for 14 days when you get back to break any potential chain of transmission. All travelers should monitor their health and practice social distancing for 14 days after returning home. And if you do travel to an endemic area, it's so important. I mean, people in Tulsa, we've noticed that the streets are empty and people are self-isolating, people are social distancing. It's important that return, especially you do that as well. Don't go to work, don't go to school, don't leave your house for 14 days. Discuss your work situation with your employer and determine if you can work remotely. If you can, that's the best alternative for now. If you can't, please practice social distancing. Monitor your health, especially if you return from spring break from travel. Take your temperature for the next 14 days with a thermometer at least 2 times a day. Monitor for fever. What we're concerned about is any temperature over 100.4 degrees Fahrenheit or higher. Also, be aware of if you start to develop a cough or have trouble breathing. Do not take transportation at this juncture. Do not get the taxis or a ride share during the time you're practicing social distancing. We're asking all those who travel to be safe and responsible. Not only protect yourself, but protect those around you. Avoid crowded places. We know that the mayor has done great work about restricting that so that we can break that chain of transmission. Limit your activities in public. If you are well and need to run an errand for essential items, be mindful of those around you. If you observe congestion in an aisle, keep moving and wait for it to break apart. Pay attention to where you are in the checkout line and observe social distancing guidelines of staying 6 feet apart. Try to make a list and get what you may need to get you through the length of your voluntary quarantine. Wash your hands before and after any trips. This is important. If you do get sick with fever, cough, or have trouble breathing, call your healthcare provider. Tell your doctor about your recent travel and your symptoms. Avoid contact with others. If you need essential items, make arrangements with a healthy friend, neighbor, or family member to drop off items at your home. If you need to seek medical care for other reasons, such as dialysis, call ahead to your doctor. Tell them about your recent travel to an area with widespread or ongoing community spread of COVID-19. This will help the office protect themselves as they serve you and protect other patients. We are continuing discussions with the Tulsa Hospital Healthcare Systems and Oklahoma State Department of Health to increase testing capabilities. There remains a national shortage of supplies. We are leaving no stone unturned to identify possible resources of labs that can verify their testing processes so that any test they might run is sensitive and specific to COVID-19. To say that these are trying and unprecedented times is truly an understatement. I can only imagine people who didn't go on spring break, that have been isolated at home, that people are already feeling stir crazy. We are coming together around staying apart. And I'm amazed at the stories I'm hearing of how people are adapting and being creative in things that they're doing to still keep their families occupied, to protect their families, and to protect each other too. Everyone who's doing that, we say thank you. Those coming back, continue to do that at a minimum. If you were not in an endemic area, social distance for 14 days. If you were in an endemic area where there was community spread, you should self-quarantine for 14 days. Essential workers, there have been a lot of questions about what's essential. Essential workers like those in healthcare, public health, first responders, our community, city and county leaders, grocery store workers, city and county officers like utility workers, and that's just the short list. These individuals are going to work to keep us all safe, healthy, and fed. stay home. Talk to your employer and determine if you can work remotely. You notice I keep repeating this because this is so important. And it's important that people listen, and please follow these recommendations. Stay home and social distance or flatten the curve. Let's bring Tulsa flat. Slow the spread. Wash your hands frequently. Disinfect surfaces. Avoid touching your face. And above all, again, please stay home. I'd like to introduce Mayor Bynum now.
Thank you, Dr. Dart. First, I really want to convey my deep gratitude to my colleagues in our other cities in the Tulsa Metro who have taken very courageous action in the last week. And in particular, leaders in the cities of Broken Arrow, Jinx, Owasso, Sand Springs, Collinsville, and then around the state. You see this in our largest cities in the state: Oklahoma City, Norman, Edmond, Lawton, just yesterday the city of Miami. Each of these cities is recognizing the importance of following the CDC guidelines. And the CDC guidelines that were issued last week were very clear. They didn't say 10 people, you're cool. It was, if you're in a state that has community spread, and we are one of those states, then restaurants, bars, and other facilities of that nature should be closed. And I'm so grateful that we have leaders in our cities around the state of Oklahoma who are putting the safety of their citizens first. Along those lines, as Dr. Dart mentioned, it's so important as we move forward in this event that people continue as much as they can to work from home. There is no magic number here. It is simply a rule of statistics. The less people you have human contact with, the better your odds of not contracting this virus or spreading it. And so we encourage everyone who can to work from home. And at the City of Tulsa, we've implemented our remote work protocols. We have also, as Dr. Dart mentioned, have a real focus on spring break and people coming back from that. And of course, every employer is different, but I think it's important that the citizens of Tulsa understand that the standard by which your city government is holding our employees on this particular issue. Anyone who's traveled out of the country or on a cruise is to first check with our city physician before they can return to work. Same for anyone who's traveled domestically through any major airport hub. Same for anyone who traveled by car to a community that has community spread and evidence of it. And even if our direct employee did not take any of those kinds of travel, if they have a family member who did, they also need to report to the city physician to be checked out before they're allowed to come back to work. Would also say that with all of our employees, we have so many employees at the City of Tulsa who cannot work remotely. First responders, people who maintain our water lines, so many other people at the City of Tulsa. And for all of those individuals, every day when they report to work, their temperature is taken before they're allowed to start work that day. And if they have a temperature that's in the range that Dr. Dart mentioned a moment ago, then they are sent home and they're to call the city physician to be assessed before they're allowed to come to work. These are all things that we've incorporated at the city government as best practices to help contain the spread of any virus, and we strongly encourage other employers in our community to do the same. There's good news for those businesses who are being adversely impacted by this pandemic event. The state has been approved for SBA, Small Business Administration Assistance. Any business that wants to learn more about that can go to sba.gov/disaster to learn about that. I also want to extend my deep gratitude to our school districts who worked very hard this last week with the recognition that there are a lot of kids in our community who rely on going to school to get food. And by having an extension of the spring break period to keep kids safe, there was a very real concern about those kids being able to access food. And so a coalition has organized free meals for all Tulsa kids. You don't have to go to one particular school or another. If you're between the ages of 1 and 18 years old, there is food available for you in this community, and people can go to mealsforkidsok.org, and that's using the number 4, not the words. So again, it's mealsforkidsok.org, and you can find the sites nearest you where that food is being distributed and the times at which it's being distributed, so you can access that. Lastly, I just want to echo what Dr. Dart said. I'm always, anytime that we have a disaster in Tulsa, be that a tornado, a flood, now a pandemic event, I'm always so impressed by the business-like, stoic way that Tulsans go about handling it. And I've been so impressed over the last week when we're going through an event of such uncertainty, an event that by its nature isolates us from one another. Tulsans are finding ways to go through that, working with one another, but doing so most of the time remotely. And so as a mayor and as someone who's in a unique vantage point to see that all across the city, I just want to say how proud I am of our community, and it really shows the character of Tulsans when you're put in a challenging moment like this. Now I'd like to introduce County Commissioner Karen Key.
Well, hello everybody. I hope you're all taking care of families and sitting at home and making the best out of this time that we all have together. You know, as we continue to navigate through this unknown territory, more and more changes are taking place every day. And this will likely continue for some time. And I ask you to remember that every change we are currently experiencing is in hopes of limiting the spread of COVID-19 so that those that need the most help will get it. As many of you know, Tulsa County Courthouse has just got a skeleton crew. We are asking, unless you have absolutely essential business, that you not come through the one door that is open to the public. And you will be asked many questions before you are allowed to enter. Please do your business by email or by using the postal mail. One of the most recent changes that affects Tulsa County is our election process for April 7th. Currently, the Tulsa County Election Board is reaching out to the involved local entities to ask for a resolution to reschedule these elections, and they are hopeful that they may be postponed for the benefit and safety not only of the public but also of our election board staff as well as the voters. The April election involves school board members' elections for Berry Hill, Collinsville, Tulsa, and Union Public Schools. It also includes bond issues for Keystone Public Schools, the City of Jenks, and Berry Hill Public Schools. Resolutions of postponement from each entity are due Monday, March 30th. And I got an update this morning. Our homeless shelter providers, they are continuing to do an incredible job working together, sharing the resources that they have, and also trying to look ahead to plan for what might lie in the future. Our jail population remains healthy. I talked to the sheriff this morning, and then last week, just over 100 folks were released by order of the courts, and so that helps diminish that population. Lastly, I want to make sure that you're not falling prey to numerous scams and rumors that you're starting to see. Expo Square, there is nobody there right now. Nothing is being staged there. Expo is just a great point for us should we need it in the future. And Attorney General Mike Hunter has made price gouging a crime. So if retailers are going above a 10% increase, you can fill out a complaint on the Attorney General's website. So anytime if you see that somewhere and you know it's obvious there's an issue, please go to your computer and make a complaint and let somebody know. Now, unfortunately, there are people out there trying to take advantage of people's goodwill, and they're wanting to help others in need. So I'm going to take this opportunity to remind you that there are legitimate entities in our state that you can work with and donate to that will have the best impacts for those who are suffering from this COVID-19 pandemic. So continue to support small businesses by purchasing gift cards that they can use later. It's almost like a small loan to them. Choosing carry-out or delivery for your meals, and look into how you can support the newly created Tulsa Community Foundation and Tulsa Area United Way COVID-19 Response Fund. You can pull up their websites to find out how to help. Now, the $3 million has been generously donated to seed the Community Foundation Fund, but it won't be enough. Please consider donating online or mail a check to the Tulsa Community Foundation. Your donation will give assistance to individuals who have lost employment and income, or who need help with medication and child care. As we continue to move through this evolving situation, please keep each other safe, be kind, and wash your hands. Check on your elderly neighbors. And if they need groceries, drop them off on their porch. And call folks who are in the nursing home and check on them, because they're becoming isolated. And my goodness, the staff who make those nursing homes continue to operate, we need to just say, we are so grateful to the staff, all of our nurses throughout this community, and our doctors who are working overtime. The stories are all out there. We cannot thank you enough as a community for your efforts to try to keep us healthy. So we've got to do our part, and that our part is to stay apart and try to make something good out of this with your family. I was walking the streets yesterday, people were just waving at each other. We're not shaking hands, we're not hugging, but we are waving, we're saying hello. And I noticed one of our neighbors' houses, the children had filled this huge picture window with children's art. It was just so, it was so cute. So people are trying, and I know it's not easy, but I think there are always ways to try to make the best out of the situation. And that's what we do here in Tulsa. And I'm very grateful for the leadership that we have in this community with our mayor and our health department. So please take all their advice to heart, and we'll get through this. So we'll see you soon.
Thank you, Mayor. Thank you, Commissioner. We can answer my questions now.
Spring break is just winding down for a lot of families. What are you guys anticipating as all these families come back to?
Well, the reality is that COVID is now community acquired in most cases. So we know we have widespread community activity. So the potential for people being exposed who travel is higher now, because we know there's widespread community activity. So, and that's why we're asking people who travel in spring break to, if they went to an endemic area, we're talking about states that have over 100 cases or more. There's no true definition for that. But if they've gone to a state with 100 cases or more, and every state in the country has COVID now, to self-quarantine at home for 14 days. If you travel, but did not go to an endemic area, continue to social distance for 14 days, and then be very aware of if you possibly start to develop symptoms.
With the testing, you said earlier that there is a shortage nationwide.
Yeah.
What's Tulsa County seeing? Have you guys been able to get a little more?
So we have, but our local labs and reference labs have been, like Christian Keith mentioned, been one of the heroes. Have been working on testing processes. The mayor gave me some really good news yesterday about certain labs we were able to ramp up. So, but bottom line is that right now we have hospitals who have a lot of people in them that are in respiratory isolation because we don't have test results. So PPE is being used, and we don't even know if these patients are positive. We need to focus on those inpatients first, health providers, and of course our at-risk demographics.
Some of the hospitals have sent us all press releases about how they're asking for masks, donations. Do you guys have any maybe information for viewers watching this who might want to donate to these people?
So we're actually got some offers yesterday. We're having our incident command team ramp up criteria for what people want to donate, what they can actually use and apply to the healthcare field, and working with the city and the county to create a place where we can actually collect and gather those.
And then a lot of different businesses are kind of popping up and making hand sanitizer out of alcohol, a bunch of distilleries. Is there anything that people should keep an eye out when they're making these purchases?
You know, I guess I'd be concerned about purchasing a homemade product. I mean, you need to be in retail business that sells a ton of products. frankly, you never know if what you're getting follows the World Health Organization's recipe for homemade sanitizer. So the recipe is very simple. Anybody can make it. I think entrepreneurship is great, but you want to buy it from a trusted, certified source.
Are there any plans being made for a potential shelter-in-place order?
Those are all part of what we're talking through with, and basically letting the social modeling data and the environment tell us what the direction we need to go. You saw how the mayor aggressively approached that last week, and we're continuing to monitor.
Now that the National Guard has been activated, do we know what happens with them now?
Really can't speak to that yet, but we have some calls later today that will get more information on that. Several. So.
All right, thanks, everyone.
Thank you.